Welcome back, everyone. It's Dr. Lindner. We are going to be talking about different types of contraction. And when we look at these three pictures, you'll see that this gentleman is doing three different things, right? In picture A, this is referred to as a concentric contraction. In B, this is referred to as an eccentric contraction. And in C, just holding the book still in midair is an isometric contraction. Isometric. So in a concentric, let's say that this was not a book, but let's say a 50, 60 pound dumbbell. Okay, it's a weight at the gym, and he's doing a dumbbell curl for his biceps over here. Wants to build up his biceps. Nonetheless, the starting position was down here at A, and the finishing position was up here, B. So he had to move this weight from A to B, move in this direction, and gravity, remember, is working downwards. We'll put a G here for gravity working downward. So there's weight to this. If he has the ability of moving the mass against gravity, point A to point B, the biceps muscle here, which originates up here and inserts down here on the radius, the muscle is shortening, meaning the origin and insertion are moving closer together in order to move the forearm. But here in B, the bicep, the origin is up here and the insertion is down here. When the origin and insertion move further away and the bicep or the muscle is elongating, that's an eccentric contraction. So think of eccentric goes with elongation, meaning the origin and insertion are moving further apart. So in A, concentric, that's the shortening phase. Concentric is when the origin and insertion approximated or moved closer together. And this young man right here was able to move the load or to move the resistance against gravity within complete control. Sometimes they refer to the concentric contraction as the positive contraction, or the acceleration phase. Sometimes they call it the positive or the acceleration phase. In B, the eccentric, they refer to that as the negative. I used to power lift for many years. I did weight training for so many years and still do. Started when I was very, very young, probably around 12 or 13. And we used to train and do these negatives. We used to just say, hey, we're going to go to the gym today. We're going to do negatives, which is holding heavy weight up at the top, starting up here at the top position, and then finishing down here, B, at the bottom position. So remember, gravity is working down. Now we're lowering the resistance or the load or the weight, and you're lowering it slower than the rate of gravity, which means you're controlling that. And the muscle here, the biceps, is getting longer. It's elongating. And when I say elongating, it's really going back to its resting state, right? It's not getting longer than its resting state. It's just going back to its normal resting state from the shortened position that it was in picture A. So we call eccentric the negative contraction. We also refer to it as the deceleration because you have to slowly lower this as gravity is trying to take it down fast. Okay, so you have concentric and you have eccentric. In the third picture, holding the arm out, it's like a static contraction. All these muscles are contracting because there's tension that's being generated. But notice there's no change in the joint angle. It stays straight the whole time. Isometric, same meters, same length. It's not changing. Here, this angle in A, that angle changed, and over here, the angle at the elbow changed. Here, it's just staying nice and straight. You're holding it out. Gravity is working down. That's an isometric contraction. Okay, and we incorporate this when we talk about manual medicine or physical medicine I use this in practice just about every day with my patients when I'm trying to change posture. We call it neuromuscular re-education, especially if someone had rounded shoulders. We would want to lengthen certain muscles that were shortened, and then we'd want to strengthen certain muscles that were overstretched. And this may be something that comes up in discussion along the discussion board, and when it does, I'll chime in. But we use eccentric contraction to elongate muscles that may be in a hypertonic or shortened state. And then we use concentric contractions to try and shorten and strengthen muscles that may be elongated. So we use this all the time in practice. So again, concentric contraction is when the muscle tension exceeds the resistance and the muscle shortens. That's what we saw here in concentric. It's when the origin and the insertion approximate each other. And that's what we saw here. Origin and insertion moved closer. When the origin and insertion moved further away, that was eccentric contraction. So eccentric is when peak tension is less than the load and the muscle elongates. It's also when the origin and the insertion move further apart from one another. The eccentric is called the negative. The concentric is called the positive contraction. Concentric is called the acceleratory phase, and eccentric is the deceleratory phase. Isometric is when the tension never exceeds the resistance, so there's no change in the joint angle at all. Okay. Now, in terms of origins and insertions that you saw me put O and I, those letters for abbreviations here. So all muscles are going to attach to bones, right? And muscles attach to bones by way of tendons. It's just that the tendon that is more proximal, and it's usually the part that's staying still, that's what we call the origin. Whereas the insertion is usually the more distal part, and it's also the part that's usually moving. So in the case of the biceps, here, origin and insertion, here it's shortened. Origin is the part that's more proximal, it stays still, and the insertion, which is more distal, is moving, that's the radial bone. And the radius is moving here, and the hand just comes along for the ride. So origins and insertions. Origins are typically more proximal. They're usually the part that stays still. The insertion is more distal, and it's the part that typically moves. Now, what are these terms? Agonist, antagonist, and synergist. So an agonist is the main muscle that's going to provide the movement. So in the case here, the biceps brachii is the primary mover. It's the agonist for elbow flexion. What's the antagonist? Well, the antagonist is going to oppose the agonist, and they are typically on opposite sides of the body. So what's on the opposite side of the biceps? The muscle back here, the triceps. They're antagonistic to one another. So if it's opposing the agonist, that's an antagonist. If we're talking about the thigh muscles, like the 4 quadricep muscles, so the quadriceps are here, what's antagonistic to them? The hamstrings. Okay. The gluteus maximus is back here for hip extension. What's antagonistic to it? Iliopsoas, which is in the front. Okay. Synergist. Synergist is a helper muscle. It is a muscle that's going to assist the agonist. So in this case here, if we're talking about the biceps brachii being a primary elbow flexor, what is a synergistic muscle? That means that's another way of saying, hey, what's another muscle that can also flex the elbow? And as you study this week, muscles, you will learn everything with a B. So the biceps brachii, the brachialis, and the brachioradialis. All of these have brachium in it, right? Biceps brachii, brachialis, and brachioradialis. Those are the three main elbow flexors. Those are synergistic to one another. Okay, when we come back, we'll talk about some of the microscopic parts of a muscle.